Hello friends, hope you all are doing great in your life. In this video, let us try to understand what is cancer screening. So screening means checking for the disease, checking for any disease in people who do not have any symptoms of the disease. So if there are symptoms and if you go and check for the disease, then it is called as diagnostic test. But when you don't have any symptom but still you go yourself volunteer for some test, then that is called a screening. Now you might ask me, so when someone is completely healthy, when there is no symptoms, then what is the need to do some tests, right? So already I have made a video on master health checkup and I have told like doing an unwanted test like this is not necessary and only those tests which are required should be done. So now let us understand why it is important, because it helps in, especially in this scenario of cancer, when you detect the disease early, it helps in saving the life. And also when the cancer is detected early, there are so many treatment options available. When the cancer is in advanced stage, like after metastasis, the treatment options might be less, or sometimes only the supportive care might be available. So and apart from that, there is improved survival rate, you can live for long time, and apart also reduced morbidity and mortality. Especially in Indian scenario, most of the cancers are diagnosed at a very late stage. For example, only 50% of the 15% of the breast cancers and 33% of the cervical cancers are diagnosed at stage 1 and stage 2. Then imagine rest all the rest of the things are diagnosed at a much advanced stage of the cancer, where the amount of treatment options available, the curative intent, everything is decreased. So and 3 out of 5 cancer patients in India do not survive, and less than 10% of the population in India are only subject to some form of cancer screening. So now let us try to understand what are the common methods available for screening. Let us try to understand the common methods available for screening for the top 5 most cancers. Each and every one of them, understanding about them is quite detailed, but I will just give a brief overview so that you can understand what is screening and what are the different tests that is available. Okay, so for breast cancer it is mammography, which I have already made a detailed video. So and apart from that, for oral cancer, oral visual examination, which means like you open your mouth and the dentist or the ENT specialist visualizes your oral cavity and identifies if there is anything which is suspicious of malignancy. So screening doesn't essentially mean that you have to get some blood test or something like that, right? There are multiple modalities which are available. Recently they are also, many people are also involved in developing some AI technology. When you have some ulcer in the mouth, you can take a photo of that, and that AI will tell you whether it is a cancerous lesion or a normal ulcer, right? So and especially for those people who use tobacco, who are at high risk, they should get oral visual examination done at least every year. Even for the general public, they are saying that once in a year we should get annual dental checkup done for a healthy teeth and all these oral cavity, right? And for the cervical cancer, it is pap smear. From right from 21 to 29 years of age, we should get pap smear every 3 years, and from 30 to 65 years of age, we can get either HPV testing every 5 years, or we can get pap smear every 3 years, or co-testing, which means like both the HPV test and the pap smear every 5 years. And the fourth one is for the colorectal cancer, which is colonoscopy, where you insert a video camera through your anal hole and you visualize the entire intestine system, right? So the fifth one is the lung cancer, which is the low dose computed tomography scan, low dose CT scan, LDCT. Right from the age of 50 to 80 years, it is done. The specificity is really good, but the sensitivity is not good, leading to so much amount of false positives. See, if I have to explain all these things, each and every one of the screening methods itself is a separate video. If you would like to, especially for cervical cancer and all these things, everyone should ideally know. So if you would like to know more about these things, please do leave it in comments. I will try to make the upcoming video. So next thing we will try to understand is precancerous lesions. So what are precancerous lesions? These are the early alerts or warning signs that there is a possibility of the cancer. So these are called as pre-malignant lesions or dysplasia. Not all precancerous lesions will turn into cancer. Some precancerous lesions may remain as precancerous lesion throughout the life, or it might convert into normal cells, or it might convert into cancer. But still there is a risk that you might get cancer. So the common pre-malignant lesions which we encounter are cervical smear, where you can find the carcinoma in situ or cervical dysplasia, which is usually seen in the pap smear. Apart from that, for the colorectal cancer, the polyps, especially the adenomatous polyps, which is usually visualized during the colonoscopy. So if you find such polyps, then you can resect it during the same session, decreasing your risk of cancer. For oral cancer, there are the premalignant lesions are leukoplakia and erythroplakia, which are nothing but leukoplakia is whitish plaques in the oral cavity, and erythroplakia is reddish plaques within the oral cavity. So usually by scraping or doing something else, these plants will not go. So these are the pre-malignant lesions. So, and for skin cancer, it is actinic keratosis, and for breast cancer, atypical hyperplasia or ductal carcinoma in situ, which is usually seen in the biopsy report when you had some tumor or something like that, and people did surgery, and finally you found the biopsy report something like that. Then it is a pre-malignant lesion. Fine. So, and apart from that, the things which I would like to emphasize are, if you have any symptoms during this period, for example during cervical cancer, you are, yeah, let us assume that you are checking every once in 5 years, but during those 5 years, if you have any symptoms suggestive of cancer, like for example any abnormal bleeding, intramenstrual bleeding or something like that, then definitely you should go and uh, make a visit to your doctor to make sure that you are not suffering from any signs and symptoms of cancer. So that is one thing. And the second thing is, like, most of the people, they're afraid to get screening test done, because like they're afraid, like if I did screening test and if something comes positive, then I have to get treatment for my entire lifetime, so then I will die. I mean, so many fears and confusions are there. See, first thing which we should understand is screening has nothing, it neither increases a chance nor decreases a chance. It just says what is there inside your body. So if you don't do screening test, we will never come to understand what is there within our body. Then we will just live with the disease. And once the disease progresses to such a stage, then we will come to understand what is happening within our body. But screening is always best, because you diagnose things early, so that you get treated early, so that the results and the outcome is much better. So this is also called as the fear of finding out. See, first basic thing is, uh, whether we know it, whether we are getting tested or not, the disease which is there, it is always going to be there. So if we get tested, it is better for us, we can know it earlier and we can start getting treatment, so that the outcome is much better. So I hope this video was useful. If you have any doubts, please do leave it in comments. And apart from that, whatever the topics that you would like to hear in the upcoming videos, please do leave it in comments, so that I can make videos on these such topics. So I hope this video was useful for you. I will see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.